The environment in which humanitarian organizations work is constantly changing. Emerging diseases, such as pandemics, can occur at any time, regardless of political or geographical boundaries. Providing humanitarian relief under these conditions remains imperative. Measures to ensure that staff and their organizations are not unduly exposed to unnecessary risks are an integral part of an organization's continuity of operations and response plans. Transportation of people and goods is essential to maintaining the continuity of operations during any emergency. In this film, we will focus on the precautions and work practices that surface transporters should use during a pandemic. These practices are known to reduce the spread of many common infections and include simple preventative measures such as physical distancing, sneezing into your sleeve or elbow, avoiding touching public surfaces, and washing your hands. As influenza is spread primarily by respiratory droplets, drivers could be exposed to influenza several times a day, whenever they are within 1 meter of another person. One effective measure is to try to keep at least 1 meter away from other people and use telecommunications to limit the number of face-to-face meetings. Other preventative measures include coughing or sneezing into your sleeve, elbow, or a tissue to reduce the number of droplets that go into the air or that could contaminate surfaces that other people could touch. Avoiding touching objects and surfaces that other people touch. And most importantly, washing your hands frequently so you don't inadvertently infect yourself.
My break's at 9:30.
At work, consider discussing with your supervisor about arranging staggered break times and flexible hours, and encourage colleagues and staff to stay home when they are ill.
Hi Phil, it's Rashad.
The good news about influenza viruses is that they are among the easiest microorganisms to disinfect. These viruses can persist on porous and non-porous surfaces for a number of hours. Now let's see how to safely clean and disinfect a vehicle. When you drive or ride in a vehicle used by different drivers and passengers, the surfaces touched by others should be disinfected to limit the spread of infection during a pandemic. How and what to clean and disinfect in a vehicle during a non-severe pandemic is simple. First, get everything you need: water, soap, disinfectant, your personal protective items, and your disposal bags. The vehicle should air out for about 10 minutes before you go in to clean and disinfect. While the vehicle is airing, a cleaner with a healthy immune system needs only a plastic apron, goggles to protect the eyes in case of a splash from the disinfectant, and cleaning gloves. Anyone who is immunocompromised and performs cleaning and disinfecting should speak with their doctor about appropriate protective equipment. Start cleaning on the inside. Clean the visibly dirty parts with soap and water, and then rinse with clean water. Next, use a disinfectant on commonly touched areas to inactivate any remaining flu viruses. Remove the floor mats and wash them in soapy water, and then rinse. Now let's discuss how to disinfect in more detail. Use disinfectants in well-ventilated areas to reduce adverse effects. Which disinfectant should you use? Many are effective against influenza viruses. If you only have bleach, dilute it by using 10 milliliters of 5% household bleach, the most common on the market, in a liter of water. Use a cloth and apply the solution to hard surfaces, letting it stand for 3 to 5 minutes before rinsing with clean water. Remember, bleach can be corrosive on metal, so don't use it on the body of the vehicle. To learn more about disinfectants, visit this website. So on the inside of a vehicle, what should you clean and what should you disinfect? Clean surfaces that are visibly dirty. Disinfect those surfaces that are touched frequently or that are suspected of being contaminated, including steering wheels, gear shift knobs, door handles, dashboard controls and surfaces, seat adjustment knobs, fire extinguishers, first aid kits, and seat belt buckles, among others. Remember, never mix disinfectants and cleaning chemicals together unless the labels say it is safe to do so. Do not use compressed air and/or water under pressure for cleaning or any other methods that can cause splashing or which might aerosolize infectious material. Since disinfectants are not 100% effective on porous surfaces, carefully remove seat covers, cushions, and carpeting to be laundered if they have been exposed to any body fluids, including blood, vomit, or feces. Tie them up in a plastic bag that won't be reopened until it gets to the laundry. It's important to know that in general, the cargo being transported and the cargo bay do not need disinfection. Now, what should you do if you have also been requested by authorities to disinfect the outside of your vehicle? Cleaning the exterior of a vehicle used to transport people or normal cargo during an influenza pandemic should be carried out as a regular car or truck wash. Ensure you are wearing the correct protective equipment in order to avoid splashing. If you have to clean more than one vehicle, use a new apron and fresh water every time. Clean the dirty areas with soap and water from top to bottom, then rinse with clean water. A low-pressure hose can be used if available. Use a disinfectant on commonly touched areas, such as door handles, latches, and side mirrors. Leave the disinfectant for 3 to 5 minutes before rinsing these areas with clean water again. After rinsing off the disinfectant, remove your apron and dispose of it and any soiled material in a sturdy, leak-proof plastic bag that is tied shut and not reopened. Your gloves and goggles can be left in disinfectant for 10 minutes. When cleaning has been completed and gloves have been removed, immediately wash your hands with soap and water or use an alcohol-based hand gel. Move the vehicle to a clean area to let it dry. Now you have a clean and disinfected vehicle ready to go. Finally, we all need to be aware of flu symptoms during a pandemic so that if we are sick, we stay away from others. If you experience any of these symptoms, please see your doctor or healthcare provider. Keeping staff healthy within a variety of work settings is an essential aspect of maintaining any organization's operational continuity. In today's world of increasing uncertainty, the consequences of an emerging infectious disease, such as pandemic influenza, will impact and necessitate a response well beyond the health sector.
Preparing for the provision of food, water, energy, communication, and the maintenance of transportation systems during a public health emergency will better facilitate a coordinated, effective, and timely response among humanitarian partners.